Good morning, everyone, and welcome. My name is Carlos.
My name is Daniela.
My name is Lizette, and today our focus is living through COVID-19. Our generation focus on safety and better practices. As you may know, confirmed COVID-19 cases are on the rise in Santa Clara County. Take a look at the update from our data dashboard as of yesterday. There is 8,533 cases, 181 deaths, and 1 new death. Our thoughts are with the families who have lost loved ones due to COVID-19.
Lizette, as you can see on the dashboard, the 20 to 29 age group make up the majority of COVID-19 cases here in the county.
And today we will spend a few moments having a conversation about topics relating to our experiences during this COVID-19 time. Also sharing best practices to stay protected during COVID-19, during this pandemic, for our generation. And even if you're not from our generation, which is Generation Z, you probably know somebody that is, and you could use some of this information that you get from us and provide it to them, which could be very resourceful.
First, we want to let you know that prior to our broadcast, we removed our face covering so everyone, including our American Sign Language interpreters, can clearly understand the information we will be sharing this morning. I want to ask you, how are you staying sane during COVID-19, whether that be Daniela or Carlos, who wants to answer that first?
Carlos, you can go first.
Okay. So for me, staying sane during COVID-19, I learn new things. I pick up different things that I like, whether that may be coding, playing an instrument, playing music. I think that although we're in this difficult situation that we find ourselves in, and it's 1 in a 100-year event, and I think it's very important that we take this time to learn new things so that we're able to find new things that we enjoy in life. There are some things that were taken from us, not being able to hang out with some of our friends, our family, but I think always learning new things, always finding new things that you enjoy is something that will be helpful. So for me, I go home, I take a shower, I eat, I play some games on my phone, I watch YouTube, and that's pretty much kind of what I do from day to day.
For me personally, the way I've been staying sane during this pandemic is usually by hanging out with my siblings and also watching videos on YouTube and watching new TV shows or movies. I've also been trying to find classes that I need to take for my major because I'm still going to college, and that's one of the ways that I've been staying sane.
Great. Not only are we having to stay sane, we now have to wear our face covering and masks. How do you feel about wearing them?
So I know that wearing face coverings and wearing face masks, they're not always the funnest of things. We know that it could get uncomfortable, it could get hot, but at the same time, we know that this protects me, this protects other people. I know that when I was doing research at Stanford about PPE and face coverings, some people weren't wearing their PPE, and that put them at a harm. So I know how important this is. I know that I need to do my part by wearing a face covering and, protect those around me, whether it's my coworkers, my family, or, my roommates or other people in the community. So
for me, wearing masks, sometimes it does get uncomfortable sometimes, especially when it's very hot. So then it starts to get very humid with the mask. But I just remember that I have to be safe, especially since I do go home to my siblings and my mother. And I know that in order for me to be healthy, it's going to help them later on. And I think it's very important to be wearing masks because it does minimize our risk, and also it slows down the spread of the coronavirus. And some ways that I've been remembering to take my mask when I leave home is usually by putting a reminder on my phone, or sometimes my siblings or my mom reminds me to take my mask when I leave.
Yeah, and another thing about that, I always have extra face coverings, whether it's in my car, my apartment, always having a spare one just in case, it gets soiled or you lose it. Anything can happen with the face covering. So, there's kind of this misconception that youth aren't as impacted by COVID-19. But, we've seen that over the last week or so, COVID-19 cases, specifically among young adults, has been increasing far greater than those in other age groups, especially, the rate at which this grows. So this has kind of created this myth about COVID. Have you seen anyone your age not following social distancing guidelines or not following the public health order? And what is your message to them?
Yeah, definitely. I've seen a lot of people my age not following the rules, still partying, and it has to do a lot with the myth that it started off with the youth that they were not gonna get the COVID, or they were less likely to. So I feel like because of that myth, a lot of us youngsters are, just going up about our lives thinking, we might fight this off. But I know recently I seen a case of a 21-year-old who actually passed away due to COVID-19. And it's actually very important for us to make sure that as youth, we keep each other safe as well as our families, because maybe we might be able to fight this off, but maybe our parents aren't. We have a lot of us have parents who are elderly, who have diabetes or any other, how would you say that? Another, like they could, another, I don't have a word.
Chronic condition?
Correct, yes, sorry.
Yeah.
And it's very important for us to keep them safe as well. There's also children at home in many of our homes, and we have to make sure that if we're going out, we have to take our masks. That we're not just thinking about ourselves and having fun. I know we're young and we want to live the best of our lives right now, because we're only going to be young for a period of time. And I understand that, there's ways that we can have fun, but we also have to make sure that, we're also thinking about others.
Yes.
So I can relate to what Lizette said. I've definitely seen some young people not wearing face covering or not social distancing, and it definitely puts them at risk, especially when they go home to their parents or to their siblings, because they can, although sometimes young people may not, they may not present the symptoms of COVID, they can actually still carry the virus and then spread it to their family members. And my message to them would be to think about others and also think about themselves, especially since I know sometimes we may think that we may be able to recover from COVID-19, but that's not always the case. I've seen some young people who have been, who did get COVID-19 and they were healthy and they were very young, but they didn't survive.
Yes. And I think another thing to really take this, especially for all the young adults, that, health-wise, it may not impact us because we're healthy. It does impact us, but not at a certain level. But if you have a chronic condition, if you're a smoker, if you have diabetes, other things, that impacts you. And when you end up in the hospital, it's not just the health concerns. You get out and you have a financial burden because you have that medical bill that you have to pay.
I would also like to point out that it's not just smoking. I think also it has to do with vaping or like the consumption of alcoholic beverages that can also increase your risk of getting COVID-19. And so hanging out with friends right now is off the table. And sometimes we want to hang out with our friends. So how is this affecting you mentally because of distance we've had to keep because of COVID? I mean, we cannot hang out with our friends, or really we have to limit our interactions with others. So how has this affected you?
So for me, I guess I was planning to have a summer vacation. That completely was thrown out the window. So I'm kind of bummed out on that. But I think at the same time, it gives me a time to, develop new things, new skill sets, prepare for college. And as for hanging out with friends, I know I can't do that. But that we're at a digital age where we can communicate with our friends, family through our phones. They're just one click away. So sometimes I'll go on Twitch and see my friends stream, right? And I just type in the chat, and it's kind of fun for me because I'm not very good at video games. So watching somebody that's actually good at video games, and kind of makes me feel that I'm actually winning, but they're winning. So.
Yeah, yeah, definitely. It's hard, especially because I love socializing. So it was a bit difficult for me to try to switch from, in person to digital. And at first it was like a bummer. I know a lot of us too were, at least my friends who were graduating, they were super excited to, graduate and just be in that person. And that all changed. It was kind of discouraging for many of us. It was a place of, how long is this gonna last? So it was a lot of that, and how Carlos had said, we're in a digital age, so that helped a lot, communicating with our friends, finding new ways to hang out virtually. I know right now, we have the parks that are open, the hike and the trails that are open. So, if you do go out with your friends, make sure that you stay within those friends. Don't try to go out to more or anything. And if you go out to the trails or to the parks, make sure that you have your mask and limit those interactions as much as you can. Sometimes, it's really hard not to not socialize. I think that's just very difficult. I think us as humans, we want to socialize, and it's very difficult, but we have to take those precautions if we are going to go out to the park, to the beach, and if there's too many people, maybe you shouldn't be there. Maybe you should look for somewhere else where it's a little bit more isolated, but emphasis on the mask, that's going to help us a lot and protect ourselves and protect others.
So what are some changes that you've had made in your day-to-day life?
You want to start with this one?
Yeah, definitely. Some changes was I like working out, so that was a bit difficult at first because I was like, I don't want to work out at home. I kind of, you're like, I can stay in bed a little bit longer. So I kind of had to put my mindset like, no, I have to work out here at home. I have my backyard. So that kind of thing, like my regular daily basis had to completely change because it all had to be at home at first, everything, well, still is at home. But everything had to just be focused like, okay, maybe today, the backyard is my gym. Okay, maybe I want to do it in the garage, I had to switch it up. So it was a lot of that. And just trying to see what else I can do at home. Since I go to school, I can't really cook at home. So I started to cook a lot more, bake, try to do more things. I was actually talking to my friends and I was letting them know, I actually just got bored of the same food sometimes, and I was like, I'm gonna add a little something to it, see how that tastes, Sometimes it works, sometimes it didn't, and I'm like, what? I'm experiencing with my spices, and seeing what else I can create. So just, I had to do a lot of that for my daily life in school. Had to be at home, so it was just how to not feel like it's a drag being at home. So I had to find that, new ways to not feel like, oh, it's such a drag, yeah.
Yeah, and I completely agree with, having to exercise at home. I think, I can't go home and pick up 50, 60-pound weight, but I could, go for a jog. I could, do some ab exercises at home. I could do some push-ups. I've obviously gained some COVID weight. People might not notice it, but I definitely have noticed it. And I think we're at this stage, some of us in our lives, where we have to, develop new skills, like I said earlier. And I think if we're doing something to improve ourselves and to develop these new skill sets, we feel like we're being productive. We feel like we're advancing in our careers, although we're not at a job, not at an internship, because maybe some of those internships, kind of went away from COVID, which kind of goes on to our next topic, jobs during this day and age, especially for young adults that just recently graduated from college, and also, school and how that's going to be looking for some of us, whether that may be, our online education, maybe a hybrid style. So that has definitely changed. So how does it impact you academically, and what have you done to prepare during COVID?
It was very unexpected when our school suddenly had to change from in-person teaching to online. And it definitely impacted how I was learning the new stuff in class. And I think right now I'm kind of hesitant about going back to school because it is going to be a lot trying to do everything online, especially since I have a lot of younger siblings who also might be doing school online. And so it's going to be a challenge having to supervise them and have them doing their homework at the same time that I'm going to be listening to lectures by my professors. And so then that's one way that COVID has impacted me academically, but especially since I've decided to change my major, and a lot of my classes are going to be math classes and science classes and coding. And I think that type of topics are much more difficult to learn online. So yeah, that's definitely some of the reasons why I've been hesitant about going back to school.
Yeah, definitely. I can agree with that. I actually have never taken online class, and after we went into quarantine, I had to find a way how to do that, because that was the most hardest thing for me. It still is. So for this fall semester, I'm just trying to figure out how I'm going to keep myself focused in school, and how to stretch out my days as well. Like, when am I going to do my homework if, I'm at home and I have to help out with something? So it's been actually very difficult, and I'm pretty sure I'm not the only one. It's many of college students, high school students, just schools, like students in general. It's been a difficult time to kind of not feel discouraged to like drop out or just take the semester off, because we're not sure how the teachers are gonna take over the online class. I know it's also difficult for the professors and the teachers. Some of them are not used to, some of them teach the old-fashioned way, so they have to learn, how to work a computer. And I think just right now it's very difficult for us as students to actually feel like we're focused in school, focused in our subjects. And how Daniela says she's switching a major, that's a whole other process that you have to go through when you're doing that. So I think just school in general is going to be a little bit hard, but I know that with the right steps and preparing ourselves would definitely help a lot more coming into this fall semester than it was when it was just so abruptly like you're going into online school. So that was for me like the most hardest thing. But right now that I know that I'm going to be doing online, I feel like I can prepare myself more. So I think also my tip to anybody who's in the same page as me, who's never done online classes, is, you know, just prepare yourself. Try to talk to your teachers in advance, how they can help you, you know, also transition, or if also they're transitioning, ask them what has helped them as well, or your peers, your what is it called? If you have siblings, I know I have siblings as well. Just be a hand to them, and you know, I'm sure that they're gonna lend you a hand or tips as well.
Yeah. I completely agree with both of you. You know, it's definitely difficult changing from in-person to online. I know I absolutely love in-person class just because, you know, I get to interact with my peers, with my professors, and, you know, during this kind of, towards the end of the semester, I was interacting with some of my former professors, and, you know, it was difficult for them as well, and kind of getting students to kind of participate, and, you know, I mean, that's a different story. But I personally love in-person learning, and, you know, for me, starting my master's at Berkeley, I know that that's going to be a completely different style of learning. For me, you know, getting assimilated to a different university, different teaching style, different professors, it's definitely going to be difficult. And so, you know, there's something else, you know, like I mentioned, work. For some of us that just graduated, you know, going out to the workforce, we're not just competing with other people that just graduated, we're also competing with people that actually lost their job as a result of COVID-19. So maybe discuss, you know, how there's fewer jobs to some of your friends right now, and kind of how they're feeling, and, you know, what your advice is to them.
Yeah, definitely. I think even like for jobs has been difficult. There's a few friends who've applied to many places, you know, but as we all know, there's limited available positions during this time, especially because we have to social distance. We have to make sure that everything is good. So right now it's very difficult. I know that after I finish my internship, I'm going to try to see if I can also find a job. And how you said, you know, a lot of people are coming, they're graduating, they want to find a job, and that's super difficult. I know it is already difficult when the pandemic wasn't happening, so it's definitely even extra, you know, like it's 10 times more difficult to find a job as a graduate student. So I honestly don't know how they have coped with it, you know, because I haven't graduated, and I'm glad that you said that, you know, you're competing, and that's good to know, because I know a lot of the youth who are watching, they're like, you know, I feel the same, I don't know what to do, but just don't get discouraged, you know, just because this is happening, continue to practice your skills at home, you know, if you're not good at an internship, practice, be like, you know what, I'm gonna present myself, I'm gonna build this portfolio for myself, and, you know, as soon as I get the chance, go for it. Don't try to limit your options. If right now, you know, you have to work at a grocery store or anything like that, take it and take the opportunity to be like, oh, you know, after this, I'm gonna go even 10 times more harder to get that that job that I actually really wanted. Because I know, you know, this is gonna be a temporary thing. We're not sure, you know, how long, but it is temporary. It's not forever. As long as we follow, you know, the guidelines and everything like that, we're gonna get back to it. So right now with jobs is very difficult. I know for me, it's just, you know, it sometimes can get discouraging, but we have to keep pushing, definitely.
I definitely have to agree with Lizette. I think right now, a lot of people my age find it very difficult to find a job, especially since we're competing with a lot of people. So, like my mom, right now she's having trouble finding a job. So basically, like people my age, people that are the same age as my mother, and people that are the same age as my brother who just turned 16. And so like it's like three of us that are trying to find jobs. So basically, it's like we're competing with people of the same age as us. And I think, especially right now, it's even more difficult because of the pandemic. And right now, currently, I'm lucky to have a job with being a part of the New Americans Fellowship Program. But after this, it's there's uncertainty about where I could apply. And that's also another reason why I've been hesitant about continuing my education, because I also have to provide for my family because my mom, she also lost her job. So yeah, that's something that affects us all.
Yeah. It's a difficult time, and it's important that during this difficult time that we're waiting for a job to pop up, we develop new skill sets, contact professors, former professors, reach out to them, ask them, hey, do you know somebody that's hiring? Do you know somebody that needs volunteers? Because sometimes these volunteering or internships, they turn into jobs. So, reach out to your connections, reach out to maybe a career center, and find new things that you could do.
We definitely want to see the confirmed cases of COVID-19 numbers fall for our age group and everyone else in the county. So I want you guys to share a few best practices to limit the spread of COVID.
So number one best practice, don't leave your house. It's plain and simple, right? You can't get exposed if you don't leave the house. But other than that, obviously, social distancing, we know for a fact, if you social distance, your exposure level decreases. If you wear a face mask, your exposure level decreases. If you wipe down surfaces that may have, these microbes that kind of spewed out from somebody's mouth and kind of fell and settled onto a surface, I touch it, I touch my face, don't do that. So I think that's kind of a best practice. If you don't need to go to the grocery store 20 times a week, just don't do it. Some of us may go to the grocery store, say, oh, I forgot to grab this. Do I really need to grab that? Go back just to that one item? Probably not. But, just reduce your exposure as much as possible. Take the trips that you need to take, and don't do anything else that puts you at a greater risk. I know it's summer. We want to hang out. We want to go to the beach. I haven't gone to the beach in such a long time. And, I could just smell like the fresh salt water. And, I miss it. But I know that I have a social responsibility to do. I need to stay home and protect my friends, my family, my coworkers. If I come here and expose somebody at work, that I don't know how severe that could get. They could end up at the hospital, or maybe they don't and they're completely fine, but I don't want to take that risk. So that's what I would say is kind of the best practices.
Yeah, and definitely. And if you do, if you are an essential worker or you go out to get groceries, make sure that you also go get tested. If you have insurance, make an appointment with your doctor. If you don't, there are available free sites for you. You can always go to them and make sure you go early as well, because due to the high COVID cases, there is a longer wait time. But get tested. If you can't do it once a week, make sure you do it at least twice a month, or as much as you can, if we would say. But if you don't have time, once a month would be best. We also want to make sure that we're staying safe and we take those precautions before, you know, you go out to, maybe if you're going to go see your family and you've been out, get tested, make sure that you're okay first before you go and bring in something to the house.
I would also like to add on, especially some young people who aren't able to drive right now, they try to get around with either like Uber or Lyft or some other type of transportation like the VTA buses. So what I would suggest is, if you are taking like a Lyft or an Uber, is to try to sit in the back and like opposite of the person, and then just kindly ask your driver to roll down the windows and make sure that your driver and you yourself are wearing masks. This will put you at a lower risk, especially since the air is going to be circulating in the car. And if you are at the VTA, try not to touch a lot of surfaces, especially since you don't know who's been there before. And try to wear your mask, especially try to wear your mask when you are waiting for the bus at the bus stop, because I know that a lot of people, they're waiting at the bus stop, but they don't have their face covering on before they get on the bus. So definitely try to remember to wear the face mask when you are waiting at the bus stop, and also when you are on an Uber or Lyft.
Yeah, and just want to thank everyone for joining us today. For the latest information on COVID-19 and testing, please visit the county's COVID-19 website at www.sccgov.org/coronavirus. Thank you for watching, and please continue to stay safe and have a great day.